Okay, hello and welcome back, everyone. This next session of NSAID, we are going to speak about non-selective, non-steroidal anti-inflammatory drugs. Okay, let's get started. As you can see here, for regarding non-selective cyclooxygenase, that means this medication inhibit COX-1 and COX-2. We are going to speak about ibuprofen, Naproxen, Diclofenac, and we have Piroxicam. We have another group of medication. Can we differentiate that? Ibuprofen, non-selective, Naproxen, non-selective, Diclofenac, non-selective, Indomethacin, non-selective, Ketorolac, non-selective, Piroxicam, non-selective. The other medication is not popular in clinical use. Okay, regarding, so we can start now with maybe individual drugs, non-selective individual drugs. We are going to cover this for medication: ibuprofen, naproxen, diclofenac, piroxicam. The reason we don't cover indomethacin due to the side effects not popular in the clinical practice. So moving to the first group of medication, we have diclofenac. Diclofenac available in two brand name, popular brand name. We have another brand name. The popular brand name we have Voltaren, and we have Voltaren XL extended release and Voltaren normal one immediate release. Then we have Cataflam. Voltaren as a salt, we have sodium Voltaren, diclofenac sodium, and then we have for the Cataflam we have potassium salt. So we have two different type of salt. When you talk about Voltaren, we have sodium diclofenac. When you talk about Cataflam, we have potassium diclofenac. Next, how this medication work? They said when you prescribe this medication will be accumulate in the synovial fluid in the joints, and this will give a longer duration of action, longer therapeutic effect if you compare that with the plasma half-life. So for the Voltaren, we don't rely on the plasma half-life, we rely on the maybe accumulation of the medication on the synovial fluid. Okay, this medication used for osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. Okay, this medication available like ophthalmic solution, topical gel, rectal suppository, and intramuscular injection. Diclofenac. Diclofenac available over the counter like a gel and could be applied for patients suffering from osteoarthritis pain and apply locally every 4 to 6 hours. Very important to emphasize on the frequency of using gel. It's not once per day, could be like 4 to 6 times per day to see the effect of the Voltaren gel. Voltaren may cause gastrointestinal ulceration, but they found Voltaren maybe less risk of compared with other NSAID. So if you compare diclofenac with the ibuprofen, diclofenac with the indomethacin, diclofenac was like less risk of peptic ulcer disease, for example. However, Voltaren may be associated with the elevation of serum aminotransferase. That mean will affect the liver function. Therefore, we recommend to use a liver function test on regular basis, like every 6 months, for the patient take diclofenac for chronic administration. So if you prescribe diclofenac to your patient, ask the patient every 6 months to implement blood test to maybe to be sure the liver function within the normal level. Okay, so we're done with the first medication. The first medication, diclofenac, cataflam, Voltaren. The second medication, ibuprofen. Ibuprofen, we have a brand name Advil, Motrin, Midol. So ibuprofen, what is ibuprofen? Available oral, topical, and IV. Ibuprofen use the same indication for osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis. Here is the important maybe concept we need to emphasize on. If you use dose less than 1600 milligram per day, this prevent analgesic effect but not anti-inflammatory effect. This is important thing. So if you have less than 1600 per day, this provide analgesic and pain relief, but not anti-inflammatory relief. Okay, ibuprofen available oral and available IV. We use ibuprofen to effectively closing the patent ductus arteriosus and the preterm infants, and this is the same efficacy of indomethacin. Normally, for use for the closing patent arteriosus, we use indomethacin, but due to the side effect of indomethacin on the kidneys, the alternative will be the ibuprofen. And the definition for the patent ductus arteriosus is like the opening hole between the aorta and the pulmonary artery. Okay, continue the information about ibuprofen. They try to maybe remind us, if the patient take aspirin, we don't recommend the patient to take ibuprofen at the same time. So if you use aspirin and ibuprofen at the same time, what they found here, the concomitant use of ibuprofen and aspirin, this will antagonize the irreversible platelet action of aspirin. So like blocking the action of aspirin. So we don't recommend to use ibuprofen with the aspirin, because this one will lead and to antagonize the irreversible platelet action of aspirin. So it's not recommended to use both, because again, ibuprofen antagonize the irreversible platelet inhibition. Ibuprofen safe during pregnancy, that's good. Ibuprofen safe during lactation, so we use it during lactation, breastfeeding, and we safe to using it during pregnancy. Keep this in maybe in your mind. The most popular safe product will be Tylenol, followed by ibuprofen during pregnancy and breastfeeding. Okay, next on the group belong to the non-selective NSAID. We have Piroxicam and the brand name Felden. Piroxicam brand name Felden. This medication, Piroxicam, has a long half-life, 57 hour, and this maybe give us warranty to prescribe this medication once daily, and use it for the same, like osteoarthritis, rheumatoid arthritis, 20 milligram per day. Piroxicam, if you use high dose, this will increase the risk of peptic ulcer. However, Piroxicam may be associated with a serious skin reaction if you compare that with the non-selective. So associated with a serious skin reaction here with the Piroxicam. If you click on the link here to give you more information. Okay, we have Felden here, the brand name Felden, and the pharmaceutical form capsule, 10 and 20 milligram. And they try to remind us with the risk factor for cardiovascular, gastrointestinal, and the peptic ulcer disease. Okay, so moving to reading a little bit of information about the side effect. Okay, Felden is contraindication in patient with known hypersensitivity to Piroxicam. Okay, Felden should not be given to the patient who have experienced asthma, urticaria, or allergic type of reaction taking aspirin. So if the patient allergic to the aspirin, it's not recommended to use Felden. Okay, so we're done with the Felden. Felden, Piroxicam, long half-life, once daily dosing, and using for the same indication, 20 milligram. If you give a patient high doses, this increased risk of peptic ulcer. The only things could be associated with will be NSAID, serious skin reaction. Okay, the last medication belong to the non-selective regarding our discussion today. All medication on the table for the discussion, but we try only to highlight the most popular medication in the clinical practice, the most popular medication in the market. So the next medication is Naproxen, and the brand name Aleve for the brand name here. Okay, so naproxen and considered like effective treatment for osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, tendonitis, available over the counter 220 milligram tablet, of course available as 500 milligram with a prescription or 400 milligram. Uh, Naproxen, they found the incidence of upper gastrointestinal bleeding lower than using with a comparing with the ibuprofen. So the naproxen less than causing of bleeding or GI system complication compared with the ibuprofen. So the safety profile of naproxen much better than ibuprofen. So the incidence of GI bleeding over the counter lower than ibuprofen. We need to remember that for the Aleve and naproxen. Available over the counter 220 milligram and prescription 400 milligram. Okay, naproxen has more favorable cardiovascular profile safety if you compare that with the ibuprofen. Ibuprofen, we don't recommend to use it if the patient suffers from hepatic impairment. So we have some maybe highlight here. Number one, the same indication, available over the counter, less GI bleeding compared with the ibuprofen, favorable cardiovascular effect, and contraindication if the patient suffers from hepatic impairment. Okay, so we discussed the non-selective COX inhibitor related to the NSAID. Our last section will be focusing on selective cyclooxygenase inhibitor.